Everyone, welcome to another edition of EdTalks. Super excited about this one because it's a topic we don't cover very often, and that is sort of community hospitals, independent community hospitals, and how they're organized and how they all work together. And there's no one better than to talk about that with me than Carly Salamone. Carly, welcome to EdTalks.
Thank you so much for having me. Excited to be here.
So, Carly, you're the president of Vantage Healthcare of Ohio. Can you tell us a little bit about Vantage Healthcare?
Yeah, so Vantage, for short, we are a coalition of independent community hospitals focused on improving efficiencies and working better together to bring access to services to our individual communities. As independent hospitals, a lot of times, we don't have the buying power and the sheer numbers that some of the bigger systems have to help them get better pricing or access to different services. But by working collaboratively, we can get a little bit closer while maintaining our independence.
Yeah, no, that's super cool. And tell us a little bit about yourself, Carly. Like, how did you get into healthcare? And now you're like the president of Vantage. It's pretty cool.
Yeah, this definitely was not the path that 15-year-old Carly would have thought she would go. I actually started as a physical education and health ed major in college, and found public health. So went into public health, and worked at our regional hospital association here in Northwest Ohio for almost 13 years. Really actually focused, it was a nonprofit program focused on infant mortality prevention, but also doing work with the hospitals, and made a switch over to one of the rural independent hospitals that was a member in 2023. And it really opened my eyes to the challenges and the opportunities for independent hospitals, as well as rural communities, and how much synergy there can be if we're willing to put aside our differences, put aside some competition. Friendly competition is okay, but to really get to where we all want to be as a group. And so working at that hospital was diving into a little bit of this work in terms of bringing other independent hospitals together. And then the then president of Vantage announced his retirement. And so it kind of was just a natural for me to take over this work, seeing that I had been doing it in North Central Ohio for some of the hospitals that are also Vantage members.
Yeah, no, that's really cool. And I don't know that many people realize just the importance of these independent community hospitals in these environments, right? We tend to think of the big cities, and you've got big academic medical centers, and we love them and they're great. But a lot of the population lives outside of big cities. And so it's great when you have a local hospital that you can go to, and it becomes so central, I think, to the communities and the life of the community. So that's
Yeah,
cool.
absolutely. And just to say, I think people don't realize that hospitals are in these smaller communities, in these rural communities. They're the cornerstones for those communities. They're basically they're little cities within a city. They are the highest employer, the highest provider of healthcare services, and just such an integral part of these communities.
Yeah, super important work that happens there in service to those communities and the families. So it's really cool. Let's talk about some of the challenges in healthcare. What are some unique challenges that these community hospitals might face?
Yeah, to start with, the biggest challenge in healthcare at this point in time is reimbursement, right? And so for your Medicare, Medicaid, it's the same reimbursement across the board, whether you're talking about a big hospital system or an independent hospital, which does not cover the cost of the actual care, right? For Medicare, they say it covers about 82% of the actual cost of care for patients. Medicaid, definitely lower than that, and varies based on the state that you're in. And then these contract negotiations with our health insurance companies. So reimbursement is a huge component of the issues that we face. In the rural communities, it's an even bigger issue, because while rural communities have an aging population, they do not have a growing population. So the intent of health insurance for commercial plans is really to offset that cost of Medicare services and Medicare and Medicaid. But when you have an older community that's continuing to age in place, you have more and more Medicare that's not being offset by that commercial reimbursement. So number one, reimbursement, definitely overall, but your independent hospitals are being hit 10 times worse just based on their inability to negotiate with some of the bigger plans, as well as the differences in the patient population that we see. And then the second biggest challenge that we face really is regulations from the government. And I am not one to say that regulations are a bad thing, right? We have regulations in place because they help people. For example, cybersecurity. Cybersecurity, we all just saw the Change Healthcare. And it was brutal, and it actually opened people's eyes outside of healthcare to what actually is going on every single day, right, in our hospitals that we're trying to fight against. But another example where big systems have the ability to share those costs across multiple hospitals to ensure that they are being compliant with the latest cybersecurity requirements or the latest changes to billing or any of the other thousands of regulations, right, that we're under. Whereas for independent hospitals, they're really trying to absorb those costs all on their own. So they're small. Sometimes, half my hospitals are critical access, which means they're less than 25 beds. But they still have to adhere to the same standards as those big systems when it comes to these requirements without any additional financial support.
Yeah, those are really great examples of, definitely the general challenges, but they're more acute, if you will, in the community hospital setting, reasons that you cited. And that's what's cool about your organization. I think I was reading getting close to 2 billion when you add all the hospitals together. And so it gives you a little bit more clout to negotiate and do the different things that you do. So that's
Exactly.
great. Can you give us maybe one example of success? I know you have councils set up, right? Where various members can meet up with each other. Can you give us an example where they did something that really helped everyone?
Yeah. So, one example I think would be, well, I can't mention the vendors specifically, but one of our affinity groups came together and all identified that there was contract that was expiring, right? And about half of them all had the same vendor, and then there were several other vendors at play, right? So our work there was putting out an RFP to several vendors to see what pricing we can get collaboratively, right? Putting all of our usage together, right? Like I talked about earlier, it's that aggregate number that gets you those better cost savings. Releasing an RFP and having vendors come back to us and say, this is what we can do for you. In the end, it led to over $500,000 a year in cost savings across the hospital. And it got us all on one vendor, which is significant, just moving forward. But that's just one example of what we are able to do.
No, it's really cool. I think you could just tell by the logic how it just makes sense to all come together, have this commonality, join forces where it makes sense, and reduce your costs or improve quality and different things like that. Carly, this has been very informative. How do people get a hold of you?
Yeah, so I would definitely encourage anybody to go to our LinkedIn page, Vantage Healthcare of Ohio, as well as they can email me, which I think you'll put in the show notes, but carlys@vantagehealthcareohio.org. There are several organizations across the country like us, and we actually are an affiliate and work very closely with one in Indiana, Suburban Health Organization. So there are a lot across the country. If you live in Ohio, we are more than happy to engage, or we can point you in the right direction for an organization. But our goal is to keep our hospitals open, keep them healthy, keep our communities healthy, and maintain our independence.
Yeah. No, it's a great mission. And like we said in the outset, so much of the population, that's where the people live. And so by having these community hospitals, as you mentioned, like the centerpiece, the cornerstone of many of these communities is super, super important because no one wants to drive a couple hours to get healthcare. And especially if you have to stay in a hospital, and it's just hard, all the way around. So awesome what you're doing, Carly. Thank you for your leadership, and we'll talk again. Thanks for being a guest of EDTalks.
Yeah, thanks for having me. This was great.